Did you know up to 50% of the people who check blood pressure at home are doing it in a wrong way? Consequently, their blood pressure recordings are false, either falsely elevated or falsely low. In today's video, I'll teach you how to check proper blood pressure recording at home so that it gives you a good indicator as what is exactly your blood pressure. As a practicing cardiologist, I bring science-backed practical tips every week for better health and wellness. So kindly like and subscribe to our channel. So why blood pressure monitoring, accurate blood pressure monitoring is important? Accurate blood pressure monitoring is important because most of the time when the patient comes to our clinic or hospital, they're usually stressed or they're anxious. So consequently, their blood pressure is elevated. When they go back home, their stress and anxiety level comes down and consequently their blood pressure are not that much elevated. So this is known as white coat hypertension. So white coat, usually the doctors wear. By seeing the white coat, the patients get stressed and anxious and their blood pressure gets transiently elevated when they come to a doctor's chamber or a hospital. So if we rely on our clinic reading, blood pressure reading, the clinic blood pressure reading most often are elevated, and if we rely on that reading and start treating the patients, we might over-treat the patients. Patient's blood pressure may not be that elevated, but since he has come to us and he is stressed and anxious, his blood pressure is spuriously elevated, so we tend to give over-treatment. So to prevent that, blood pressure monitoring at home is more important because an accurately monitored blood pressure at home gives a better idea regarding whether the patient is really having high blood pressure or not. So that's why a proper blood pressure monitoring at home is very, very important. So if you do not check blood pressure adequately at home, your blood pressure treatment might be hampered. So that's why in today's video, I'll go through about how to check a proper blood pressure at home so that we get a good, correct reading. So first of all, whenever you are going to check the blood pressure, make sure that you have rested adequately. At least 5 minutes of rest you should take before checking the blood pressure. Otherwise, blood pressure might be spuriously elevated. Second, the sitting position. When you are checking the blood pressure, you should sit on a chair with your back supported and your back should be erect and your legs should be on the floor. Both the legs should be on the floor and legs should not be crossed. Third thing important is that there should not be any smoking or coffee and tea intake, because if you smoke or tea and coffee intake within the previous 30 minutes, your blood pressure might be falsely elevated. So all those things are very, very important. Next important thing is that the position of the blood pressure cuff. So blood pressure, whenever you are checking, this is the blood pressure cuff. So when you put the blood pressure cuff, it should be put on the arm and it should be put 2 centimeter, almost 2 finger breadth above the elbow joint. So this is the proper positioning of the blood pressure cuff. So that is very important because if it is not positioned properly, you can get a faulty reading. And at least you should take 1 or 2 readings over a period of 2 to 3 minutes. At least 2 readings you should take. So there are lots of error which can happen while taking a blood pressure, especially at home. So which are the errors? The first and common error is that the cuff size. We usually have, this is known as cuff, blood pressure cuff, through which we measure the blood pressure. So this cuff size, actually there are 3 cuff sizes. One is for standard cuff sizes, which is normally for people we usually use in standard cuff sizes. Those are very obese. Those who are having excessive body weight, for them we require a larger cuff size. And those who are quite small in size, slender in size, for those we require a smaller cuff sizes. Because same cuff sizes, if you are checking for a normal weight person and if you are checking for an overweight person, will give a different result. So it should be adequately, cuff size should be adequate. So how do you know the cuff size is adequate? For a normal body weight person, the cuff size should be around 22 centimeter to 32 centimeter. But somebody, if it is obese, more than 80, 90 kilos, very obese person, for that you require a bigger size cuff. The cuff size should be from 32 centimeter to 42 centimeter. At the same time, if the person is very lean and thin, in that scenario, you require a smaller cuff size, around 17 centimeter to 22 centimeter. So cuff size matters. So one cuff size doesn't fit all, because if the cuff sizes are small, suppose it's an obese person and you have put a small size cuff, it will give an elevated view. So cuff size is something which is very, very important to take into consideration. Second is that the arm position. Your arm should be positioned at the level of the heart. Your heart position is here, so your arm position should be at the level of the heart. If the arm position is above the heart or below the heart, then also the blood blood pressure recording will be falsely more or falsely less. So arm position should be at the level of the heart. And while checking the blood pressure, you should not, neither the patient nor the person who is checking the blood pressure should talk, because if you talk, then once again the error might happen. So what are the common BP measurement errors which happens common? First is the incorrect leg position. You have to put your leg, both the legs on the floor, but if you cross your leg, then spuriously elevated BP will be shown on the monitor. So do not cross the leg, put both the legs on the floor. Second is that immediately after an activity, after walking or jogging or running, should not check the blood pressure, because you should take at least 5 minutes of rest, because immediately after walking or if you have done some strenuous activity, if you check the blood pressure will be spuriously elevated. So at least should have a 5 minutes rest. And another important thing is that while checking BP, before checking BP, you should go for urination, because if you have a full bladder, then also it spuriously elevates the BP. So these are the few important small things, but which usually you should keep in mind. Otherwise, you can have a falsely either higher BP or falsely lower BP, which can hamper your treatment. So how do you assure that you are getting a proper BP? Most important thing is that assure the cuff size, whether cuff size is adequate or not. As we have discussed, different cuff sizes for different individuals. If it is normal body weight individual, normal size cuff. If an obese individual, larger size cuff. If it is smaller size individual, smaller size cuff. And actually, how to know whether the cuff size is adequate or not? For that, important thing is that this is the cuff, and inside the cuff there is an inflatable bladder inside the cuff. This is the total length of the cuff, and inside the cuff there is a bladder. And this bladder, when you put on the arm, the bladder length should cover the whole of the arm circumference. The length of the bladder. This is the length of the bladder. We should cover the whole of the mid-arm circumference. And the width of the bladder. This is known as the width of the bladder. And width of the bladder should cover around 40% of the arm circumference. So this is two measurement you should know, that length of the bladder and as well as the width of the bladder, depending on your arm circumference. And the mid portion of the bladder should be over the artery, brachial artery. And brachial artery is usually on the medial side of the arm. Around this side is the brachial artery. So mid part of the bladder should be over the artery, and it should be 2 finger breadth over the elbow joint. So these are the few precautions you should need to take. So how frequently you need to check the blood pressure? That depends. If you are having a normal blood pressure, then once in a week you can take a blood pressure recording, that's fine. But if you are having a high blood pressure or you have changed your medication because of high blood pressure, then you need to check the blood pressure more frequently. Ideally, you should check blood pressure twice in a day, in the morning as well as in the evening, and the timing should be more or less constant. Like morning you can see around from 6 o'clock to 8 o'clock before taking your medications, and evening you should take once again around 6 p.m. to 8 p.m. and write it down on a log, and over a period of week you write it down on a log to show it to your doctor. This is very important because it gives an idea to your treating physician as what is your correct BP, what is your average BP over a period of 7 days. Because as we have discussed previously, clinic BP might be wrong because the patients are usually stressed and anxious. So if you like our content, kindly subscribe to our channel and like and subscribe and share it to somebody else. So that's why it is very important for all of us to know how to check a proper blood pressure recording at home, because if you check a proper blood pressure recording, chances are there that you will get an adequate treatment for your hypertension. You won't get an over medication, you won't get under medication, because both over medication and under medications are dangerous. So proper blood pressure recording at home is very, very important. So if you like our video, then I would suggest you to see this video, which checks about why there are elevated BP in spite of you taking the medications and proper medications. Thank you all for your patient hearing.